Well, hello, CK. It is Philip Mock here, the project coordinator of the Prosperity Roundtable. For those who don't know us, we are a local poverty reduction initiative here in Chatham-Kent, Ontario. And we're coming back at you with a whole brand new series focused on talking about the homeless enumeration. And with us tonight, we have Tara Lozon, a supervisor at Employment and Social Services, and Lori Bailey, who's the general manager over at Hopehaven. Welcome to you both. Thank you so much for joining us.
Thanks, Phil.
Thanks, Phil.
I'm going to turn over to Tara. If you want to both introduce yourselves, Tara, why don't you start off and introduce yourself and explain a little bit about employment and social services. We'll let Lori introduce herself, and then we'll jump right into it.
Great. Yeah. So as Phil said, my name is Tara Lozon, and I'm a supervisor under the Homelessness Prevention Program here with Employment and Social Services. So a lot of the majority of our work is encompassing our homeless population.
Well, we're so glad to have you here, Tara. Thank you for joining us. And Lori, yourself.
Thanks, Phil. I am the general manager at Hopehaven, and we were previously operating as an overnight emergency shelter just for homeless men in Chatham-Kent. And since the pandemic, we've actually been open as a daytime program offering a hot meal, shower, emergency clothing, free laundry services to men and women experiencing homelessness and those that are precariously housed.
Wow. Thank you. I'm so glad you both could join us today. And thank you for introducing yourselves and telling us a little bit about employment and social services in Hopehaven. Now, before we jump into a couple questions and just a conversation, Tara, I hear that you're looking to do a short presentation about a homeless enumeration that just occurred, I believe, a month or two ago. What is the homeless enumeration? Tell us all about it.
Yeah, so I definitely do want to share a few things, a few slides before we jump into it. I have been asked that question a number of times. What exactly is enumeration? So for us, it's the measurement of the number of people experiencing homelessness over a specific period of time. So for lack of better words, a snapshot. We chose the method of a point in time count, which is referred to as a pit count, and it's intended to capture the numbers and basic demographics of people who are homeless at a single point in time, in our case, a single night. So we can certainly go through some of the slides here. I think there we go. So in terms of who helped with the survey, we had, as you can see, a few community partners very willing and excited to have us or help us. So Chatham-Kent Hopehaven, Lori, who's with us, the Chatham-Kent Women's Centre, Canadian Mental Health Association, the Chatham-Kent Emergency and Rapid Rehousing Program, as well as our homeless response line, and then several divisions within the Community Human Services Department at the municipality. We had, of course, ESS help out, our housing division, as well as the childcare and early years divisions. And in terms of where we surveyed, you can see there are a number of locations here. So what we did is we had set up a table at some of our community partners' office buildings. So you can see the list here. We were at Access Open Minds, Hopehaven, Chatham-Kent Health Alliance, Chatham Campus, Chatham-Kent Community Health Center, Wallaceburg site, Blue Water Methadone Clinic, both Wallaceburg and Chatham sites, Chatham-Kent Women's Centre, our ESS building here, the Salvation Army on Raleigh, Outreach for Hunger, Praise Fellowship, St. Andrew's United Church, our CK ERP program, as well as the homeless response line, as I mentioned. We covered the majority of the motels where we knew there were people staying there temporarily and possibly long term. We also had a list of unsheltered locations where perhaps we've known of individuals sleeping rough there prior, or Lori and her team have quite a big reach in the Wallaceburg area, so their team really took over that space for us. Okay, so this is just a little bit of an overview. So our point in time count date was October the 19th of this year. We extended to the 21st just to make sure we were able to cover as many locations as possible. However, keep in mind that if we were asking someone to complete a survey on October 20th, we were relating it back to where they slept on October 19th. So if they were not homeless on October 19th, then they would not be moving forward to complete that survey. As you can see here, we had 28 volunteers that surveyed the Chatham-Kent residents at 31 different survey access points. So we had 189 people approach to see if they would like to try the screening. And out of that, we had 149 people complete the actual survey. And from that, we had 47 new individuals added to our by names list. That was it.
Short but sweet presentation.
Short but sweet. Lori, do you have anything to add to that?
No, I don't think so. I think just to clarify maybe that there was there were checkpoints in place. So although it was done over 3 days, we were very conscious to ensure that people weren't surveyed more than one time. Or weren't counted more than one time.
Fantastic.
Yeah.
Thank you so much for giving us a quick overview of enumeration. I think that word in of itself, sometimes people hear it and go, "Well, numbers, counting, what's it all about?" And so it makes me think, and this is a question for both of you. Tell me a little bit more about the planning process behind enumeration, including, how did you select some of these locations, the volunteers that were involved, different organizations, and specifically the date of October the 19th?
Yeah, so the early stages of planning started in August and really ramped up September and into October. So I'd say like the early stages for me were really about figuring out how I wanted the event to work and how it was going to progress. So one of the things I wanted to do was really take a good look at the survey locations that we used in 2018 for that enumeration and match them up with the number of surveys that were done at each location. That really helped me to figure out where maybe we didn't need to be this time around because there were just no surveys brought forward. And so knowing that we had a little bit less time, okay, a lot less time to plan this enumeration and significantly less volunteers, I really had to be careful in the locations in terms of the number of locations. I think that when it came to selecting volunteers, it came very easily for the most part. Lori was more than willing to dive in and become like my co-partner in this, which was great. And she helped to recruit her staff and volunteers to help us out. And I had very similar responses from Canadian Mental Health Association, the Women's Centre, the Chatham-Kent Emergency Rapid Rehousing Program, and our homeless response line. So it was very easy, I would say, to get the buy-in for people to come out and assist us. And as Lori knows, we held multiple training sessions to make sure that all of the volunteers were well enough versed in the enumeration process and what that might look like and some of the questions that we might ask. And that way they felt more comfortable going into the field. As for the date, I wanted it to be a cooler month, but not too close to December for multiple reasons. One being that our report to the ministry was due early December. So October seemed reasonable as it tends to get colder in the evenings. And we wanted it to be somewhat later in the month. Just because anyone that is experiencing homelessness who may be receiving social assistance, typically the end of the month is when they're a bit more limited on funds. And so they could possibly be sleeping rough or just sleeping homeless, but maybe at somebody's house. So essentially, I was trying to pick a date that would capture the most realistic number.
And it's interesting you mentioned that because you're right. October 19th is that fall weather. It's not super cold that where individuals are going to be inside or finding indoor accommodations fully yet. And it might be more willing to reach out to different services. And actually, we have a question from a viewer. Harry wanted to know, would the temperatures have affected some of the response rates or how many people you were able to connect with for the enumeration?
Hmm. Um, yeah, I mean, I think in a way that it did. There was several evenings that we walked the streets quite late, and what we actually had done is a few people that we had spoken with earlier in the day said, you know, your best time to go out is, you know, 11 o'clock. Folks are still kind of wandering the downtown area and haven't quite found the shelter because it is getting so much colder. So, you know, we certainly followed their advice because, you know, some of those individuals that were helping us know the best. So I think had we perhaps not listened to that advice, we may not have had as great of a response rate in the evenings for sure.
Good to know. Good to know. And Lori, I wanted to jump over to you. It sounds like you were heavily involved in the numeration as not only a volunteer but as the general manager at Hopehaven. How did you get involved in numeration, and what drives you to sort of be involved in the enumeration here in Chatham-Kent?
You know, Phil, it's so Tara started to talk to me about this, and we're at Hopehaven, we're seeing sometimes 40 people a day that are coming in to access our services. So it truly seems like almost a given that that would be somewhere to start, or that would be a place where you could collect um, valuable information. And I know that we have Hopehaven, which is in Chatham. We also do outreach in Chatham once a month where we're taking food and emergency clothing out, and as well as information out to folks that are in Chatham that might not know about our services or just might not be accessing them for whatever reason. And then once a week in Wallaceburg, we're doing the same thing. So it just kind of makes sense that we would be part of a process of collecting data. And I have to tell you, when we first started to talk about it, I thought, well, I don't know how, I don't know if people are going to want to discuss their homelessness. I don't know if they're going to want to talk about the reasons that they are where they're at, and because we ask some very pointed questions. And um, really being part of this just confirmed what we already think, and what drives us in our daily practice, and that is that when we ask questions because we really want to know the answer, people want to tell their story, whether it's somebody experiencing homelessness or you or I. Um, that's a just basic humanity. So to be involved and be driven to collect the data was critical. We need people to know what is happening in the community. And by people, I'm talking about neighbors. We need people on local government, local levels of government, as well as higher levels of government to have a really accurate picture of what's happening in Chatham-Kent. So it was for us, it was easy to be involved, but it was fantastic to be asked to be part of it. And I think that, you know, we were able to really get a really good snapshot.
Mhm.
You know what, Lori, what you just said to me really rang true in the sense that with enumeration, we are collecting data, but at the end of the day, these are individuals that are living in our community. They're part of our community. And it is part of just being a perfect neighbor, a good person to understand what other people are going through in this community. And I think you just really recognize the human aspect to enumeration. It's not just about numbers and collecting data, even though that's very important to this work. It's also about connecting with people.
Mhm.
And I really appreciate that thought. Thank you so much, Lori. as we transition into some further questions or conversation about enumeration, Linda reached out and had a question about your numbers, Tara. She was just wondering the numbers we are seeing in the huge increase in the amount or the number of individuals during your point in time count. She was asking, are all of these individuals homeless CK residents? Are they all part of the CK community?
That's a great question, and that's a question that we get asked a lot. So when we did the enumeration surveys, only 5 unique individuals were confirmed to be from out of the municipality. So these individuals had moved here to a local establishment that may offer extended stays, but the lack of a lease would not make it a long-term housing. So there was about 8 individuals that we couldn't really verify a history in Chatham-Kent. But so that really means that 93 to 98% of those homeless in CK actually do have significant familial or social connections to the community. So yeah, I think it was a very low percentage.
Um, Phil, if I can just speak to that as well. I
Yeah.
know that we get these calls and we get questions at Hopehaven often if we are actually providing services to CK natives, or like there's people are bussing in um, bus loads of folks from other regions that are experiencing homelessness and having them kind of arrive in Chatham-Kent. And I understand the thought process. I understand that it makes it a whole lot less our problem if it's not our neighbors. But having spoken to the folks that come and use the services at Hopehaven, as well as the folks that we're seeing in Wallaceburg, I can personally assure you that these folks are in fact your neighbors, your neighbors' children, your neighbors' parents. They are people that have been living in this area for a lifetime and have experienced job loss, or so so there's just a multitude of reasons that they are now experiencing homelessness, but they're local folks with local issues, and I can't stress that enough.
Yeah.
Great points you both made, and I appreciate the reiteration that this is a local thing. These are people in our community, and at the end of the day, be it that they're from our community or not, they're still here now. And does that mean we're going to deny service or deny acknowledgement because they're not necessarily from our community? So I appreciate that human perspective that we really need to maintain as we talk about enumeration. So thank you to both of you for that, for those pieces. When we talk about enumeration itself, you mentioned, both you were talking about sort of the point in time, the October 19th, and I think, Terry, you mentioned specifically, if somebody was talked to on the 20th, the 21st, but they were not homeless on the 19th or before that date, they were not included in the count. Some
Right.
might say, well, then you're not capturing every single individual who is homeless in the community. So can you kind of talk to us about how enumeration really works in terms of counting those numbers and what you mean by point in time? And when we talk about the numbers, what does that mean in regards to the larger group of individuals who are homeless in our community or at risk of homelessness?
Yeah, for sure. So the point in time pick count, it really is intended just to be a snapshot in time. We know that it is certainly not perfect, and we realize that by us counting 171 unique individuals experiencing homelessness on October 19th, we realize that that is probably a minimum and that there are more. However, that was our best shot at trying to get somewhat of a number. And really, like, we know the need in the community is high, and so we really want to make sure that our partners at the province know this as well. And by doing this, although again not perfect, it certainly gave us an idea. And case in point, in 2018, when the enumeration was done, to 2021 in October, our homelessness population increased by 144%. So although, again, it may not be an 100% accurate number, it's really showing that the need in our community has grown significantly.
I mean, that's a significant increase in those counts. I appreciate that conversation around, we know there's many more individuals who are experiencing homelessness in our community beyond the numbers we received on October the 19th. But these numbers are indicative that we are seeing this huge increase in the volume or the number of individuals who are experiencing homelessness in the community. And Lori, kind of turning into to talk to you about a piece here about enumeration. We've had some questions from viewers talking about, COVID-19 most likely has affected the homeless issue in our community pretty significantly. From your perspective, when you were working with Terra on enumeration, what really stood out to you about the data that was collected, and connecting that to kind of a larger question of any unexpected learnings that might have come out of this process?
Um, yeah, I think certainly there are so many different reasons and factors that can contribute to where a person is in their life, whether it be that they're experiencing homelessness or not. So there was, I don't know that I would say personally that I was surprised. Um, uh, I think that people, when we talk about the cost of rent and what the numbers are for rent, when somebody on a fixed income is expected to pay, $1,200 a month, and that's a minimum. That's just not realistic. And so um, that would be hard for a working person who didn't have any challenge and had established housing and had lots of supports in their lives. I would say that would be a hard number to start at. So was it a terrible surprise to see that that is a large contributing factor? No. Ultimately, the solution to homelessness, that's what everybody asks, and is affordable housing, and it doesn't exist right now. The numbers are so low. So um, I don't know that there were any surprises. There was a lot for me, anyways. Just the reality that people are disadvantaged trying to just pay basic rent. We're not talking fancy places here for $1,200 a month minimum. So, yeah, I don't know. I didn't find anything terribly surprising, but just concreted. Yeah.
No, it's interesting. You bring up a really good point about a housing. I mean, this work with homelessness and the individuals experiencing homelessness, we talk about a housing first approach, or ensuring there's affordable housing for everyone in a community, to ensure everyone has at least the stability of housing to move and thrive in their other areas of their life. And you're absolutely right. We just do not have enough affordable housing in this community. And this isn't just a Chatham-Kent challenge. This is Ontario, across the country. This is a significant issue that's been growing ever since. I think COVID-19 has really played a role in bringing this to light for a lot of individuals, that we just don't have enough affordable housing. And I really appreciate your points there. Tara, kind of the same question to you. Is there anything that stood out to you in the data that was collected?
I mean, the one thing, I guess, was like the number of people using transitional style accommodations, like motels, for example. The need has grown so much through COVID. So I think that when we first set out to survey some of the motel settings, we didn't maybe realize how many folks were going to be there that were experiencing homelessness. Specifically on October 19th. So we certainly had a bit of a we were at one particular location and we were surrounded all of a sudden once some of the folks figured out what we were doing there and they wanted to be a part of it and wanted to complete the surveys. So we had to run out and grab more, for example. So I think that was certainly surprising. But again, we knew that that was happening and that transitional style accommodations were becoming more and more, I guess, necessary because of the cost of rent. So yeah, I think that was probably the biggest surprise or learning that I took away from it.
It's really interesting how we are seeing such an increase in the amount of individuals experiencing homelessness in this community. And I think when I first heard the results of enumeration, to Lori's point, I was not necessarily shocked with the increase. I think I was not expecting it to be that much of an increase in such a short period of time, but recognizing how COVID-19, among various other factors, because COVID-19 might not have affected certain individuals in certain circumstances, uh, but there's a variety of factors that you spoke to, Lori, about why individuals are in these circumstances. And I would love to ask you a question, Lori, which is, what are some of the circumstances that place individuals in these positions where they are experiencing homelessness from from the work you've been doing at Hope Haven and just your volunteerism in the community, if you feel comfortable sharing?
Sure. I don't think I would be surprising. I don't think it would surprise anybody if I said that mental health and addictions are high on the list. Um, and they certainly are for a number of reasons. And certainly we know that COVID-19 has not helped that at all. We are also aware that there is a lack of support for some of those um, challenges in the community. So that those are fairly high up on the list. Um, but I there are a lot of things. There are again tenancy disputes and conflict and issues, um, and family breakdown and people don't have the reserves that they maybe had, that our parents maybe had. So I always say that if you think about your own life for a minute and think about an emergency or something that could happen to anybody. Anybody could have a job loss. Anybody could have a surprise illness or an accident. Anybody could have um, something happen that you really have no control over before you have a chance to um, prepare for it. And so, in light of that, all of a sudden, there was a time when people had a little bit of a cushion. But if you don't have that cushion, and it's hard to have today with costs and groceries and everything that's they say grocery prices have gone up by 40%. So if you already have some of that and you're already kind of on the brink, it doesn't take very much to push you over. Any of those life occurrences can happen. And there is a fair number of folks that are using our services, be them experiencing homelessness or precarious housing. And by precarious housing, I mean, we have people that are living without hydro, without heat, without water, um, and they're using our services. So um, those things can befall anybody. And I think that the numbers and the reasons are just vast. They really are. I I have talked to folks who had a marriage breakup and nowhere to go, and they're now living on the street. And so I could tell you 1,000 stories. For every person, the story is unique, and there's a lot of contributing factors, trauma and just things that kind of build and mount on top of one another, and then throw in a little bit of housing that isn't affordable for anybody, and here we are.
Mhm. I
Yeah.
appreciate your thoughts. Go ahead, Tara. Go ahead.
Sorry, Phil. I was just going to add
Mhm.
to that too. You mentioned addiction as well as mental health, and from our survey findings, we had 75% of those respondents say that they struggled with addiction, and 69% admitted to having mental health issues. So that certainly supports what you're saying as well.
I think it's important to really reaffirm that with individuals experiencing substance use or mental health challenges, this is an opportunity to recognize that this is not about blame. This is not about individualizing and saying, they should have pulled up their bootstraps and figured it out themselves. That's not an appropriate response to someone who is experiencing those challenges in our community. And I think it speaks to how vast and how big these challenges can be, because I know, Lori, you're heavily involved in this work. Tara's involved. There's a lot of community partners, government, nonprofit, education, even private sector involved in all this work. And we have a question from a viewer that I think ties really well into this conversation, which is, with all this conversation about enumeration, recognizing some of the vast challenges that exist in working to address homeless issues in our community, how do we get more stakeholders and maybe political figures to be truly invested in this work at the tables, doing the work alongside those on the front lines, even people who are experiencing homelessness? It's often spoken about, but how do we actually achieve real action? The viewer also followed up by saying, I think hosting these types of sessions will be great to continue education. But from both your perspectives, what do you see as some of the ways we can get to real action and get those political figures really invested to see real change?
I can start, Lori, if you want.
Sure.
Okay. I was just going to say, first of all, yes, I do agree that we certainly need more opportunities such as this. I know that in the new year, we do plan to hold several community consultations surrounding homelessness in Chatham-Kent. They'll take place roughly from January to March. They'll really focus on the not in my backyard, otherwise known as NIMBYism. This is because we've certainly can see how difficult it can be to secure locations for affordable housing developments or emergency housing services. So I think really having anyone who has somewhat of an interest really support our plans or the municipality's plans for affordable housing developments, emergency housing, or anything in between that. Lori, do you have anything to add to that?
I was just going to say that the first step really in getting investment from anybody is getting the data. So that is why the enumeration is so important. And um, it is a critical piece. If we can't say we know that those experiencing homelessness, those numbers are higher than they were 3 years ago. I mean, we can say that, but it doesn't mean anything until we can back it up with some hard and fast data. So I just can't say enough how important it was to be out and collecting and talking and getting authentic connection with folks. So that's what I would say is the first step. And then again, the community recognizing that these are your neighbors and this is in fact in your backyard. So we can't say it's not our problem, and we can think that this is a big city problem, but it's this city's problem. It is a big city problem. It's every city's problem. But I just think that's the beginning. It's very hard to expect any level of authority or government to step in and have an interest when we, as a community, aren't really that interested in it ourselves. So I would just say that that's the start.
Yeah, and to build on that, ignoring it is not going to make it go away. So, I mean, we can have these discussions on how to move forward, and we certainly need to be respectful of any neighborhood concerns if we're talking that way. But yeah, I think that we really need to just face it head on, and with the community's help, of course.
I want to build off what you both said, because in this work, as be it homeless reduction work, poverty reduction work, anything along that spectrum, we end up relegating it to the government or nonprofit sector, and that's their job. They can do it, and we just want to see the results. Frankly, at the end of the day, this is an effect on our entire community. This is an effect of our province, our country. We need people in this community to come together, work together, and we need to be listening to what experts have to say. We need to be listening to the research, as we talked about, as you just said, Lori, with the enumeration. What's the data showing us? Why are we in this circumstance? What's going to work to move us forward and address some real action items here? And I see that every day, actually, in the committees and tables we all work at. We listen, we work really well between sectors with each other. I think it's really time that our community is involved in that process to listen, learn, and be involved in it, because I think they want to. In many ways, they want to be involved. They want to support the work, and they need that support to know what best is going to work to address some of these challenges in our communities. Go ahead,
For
Lori.
oh, sorry, Phil, I didn't mean to cut you.
No, please go ahead.
Just further to that, I just have to say, talking about community buy-in and support from our neighbors and our partners, at Hopehaven, we are very fortunate. The community really supports us. It's amazing how much support we have from the community. We have classes that collect donations. We have just a vast teams. People are collecting and really wanting to know about what we're doing. And I have to just make a little plug here and say that if anybody is interested ever in talking to us, or for confidentiality reasons, we can't just have anybody stroll on in. But we can certainly give a tour and let you see what we have there. Um, and we're grateful. We have a lot of support from the community, and I do believe that the community wants to be part of the solution. And it's hard because they don't know what to do. We don't know what to do. Um, but I think if everybody's working together with a common goal at the end, we're much more likely to get there.
So well said. And it's so funny, because I just want to pull off what you just said there, in that, as I kind of said, we relegate this to the nonprofit and government sectors. And yes, we have some research. Yes, we have some things we're working on and things that are being done. We have shelter approaches. We have housing first strategy approaches. We have housing approaches. At the end of the day, though, there's more knowledge in this community that we can tap into collectively and work together to really drive home and see real systemic or community level change to address some of these challenges. I mean, even sitting around some of our tables, we talk about how we can address the affordable housing crisis. That's a big task. That is not a simple, straightforward question like, oh yeah, I got the answer. There's no one answer. You're right. People want to be involved. And I think this community is extremely passionate. They want to support each other. That's what I keep seeing every time I go different places. People want to work together. And so I think that's a big message that I have learned over my time here. And I think part of the enumeration, as Terry, you were saying, as you move into community consultations moving forward, I think that's part of that work, is carrying that connectivity with the community forward, if I'm not mistaken.
Yeah, for sure.
And so, just to bring us back to sort of a little bit about enumeration here again, you did enumeration back in 2018.
Mhm.
And back then, I believe it was over a longer period of time. Your period of time that you tracked, it was longer, and you had a lot less individuals that you connected with. What happened between 2018 and now, and how did those numbers change?
Yeah, it was certainly um, a huge difference. So I think part of the last time we did this, there were several reasons why it was done over a longer period. The province was asking municipalities to do what they call a registry week, and we're wanting to formulate a by names list for each municipality. And all that means is exactly how it sounds. So it is a current list of anyone experiencing homelessness in that municipality. So it's a live list that we update daily. And so part of making it a longer time period in 2018 was to make sure that in developing that list, we captured as many people as possible. Um, it was also the first time that we had done anything like that. And so there was a lot to learn, a lot to plan out. It took almost a year to pull that one together. They had over 80 volunteers in that year helping, and we had 28. So it was certainly a big difference in numbers that way as well. But there was certainly some noticeable differences even in the data, some which we're still trying to figure out exactly what that means. And we probably will continue to dive in and figure out what it all means. But maybe I could just point out a few of what those differences were. Our youth population had dropped by 60% from 2018 to 2021. So we're still really looking into that one to see the reasoning behind that and what happened. Similarly, we had police interactions had gone up 255% from then until now. Ambulance rides went up 450%, and ER visits 467%. So, I mean, those are huge differences. And I think there, of course, are many possible reasons for those increases, but perhaps it could be the use of encampments, having an emergency housing program, increased overdoses, coping with COVID stress or not, limited access to supports with everything going on with COVID. And yeah, so I guess another one of the major shifts that I noticed from 2018 enumeration to now was the number one reasons for becoming homeless. So this time the number one reasons were actually tied, and it was tenancy related conflict and or family breakdown. So that increase specifically for tenancy related conflict had gone up 161% from 2018. So those were just a few of the notable differences that I had. I'm sure there's more, but those ones were the ones that really jumped out to me.
I think it's important to say in the last 3 years, the number in some regard, despite the fact that the numbers are higher, I think we're doing a better job. And I don't, I hear people ask a lot of times, like, what are you doing about this? Or what's happening in the community? There is so much outreach happening in Chatham-Kent. There are a lot of groups. Certainly, Hopehaven is not the only group. There are a lot of groups that are out there becoming aware, trying to actually find people and where they are staying and where the encampments are, where people are living in solitude, unsheltered. So there is a lot more of that, and as a result of that, we can get maybe a little bit more. I'm not suggesting that the number wasn't accurate 3 years ago. I just mean that we're out there doing. There's groups out there doing this work, and so it's a little bit easier to find the folks that are experiencing homelessness.
Yeah, and like you said, there are numerous groups doing this. Rock Missions is one of them. They're doing this work as well and connecting people to the services that they need.
It's that outreach piece I find very interesting because a lot of times we expect individuals to come to our office maybe to access a service or supports in the community. And outreach is very much we go to where individuals are at and work with where they're at in the community. When we say we work with where they're at, if today we need some toiletries, that's what we're doing. If tomorrow we need to look at getting a ID card for for something else, we're going to get an ID card. It's working where they're at right now. And talking about outreach from Hopehaven's perspective, Do you want to speak a little bit more about outreach that either your organization is doing or what the benefits of outreach are, Lori? Because I think that's a really important point to make.
Sure. So let me tell you that Hopehaven was not involved in outreach until COVID-19. And what happened was we opened as a daytime program, and then we began, and we had limited hours. Initially, we were open only 3 days a week for 4 hours a day. And then we became a warming center in the cold weather, as we are this year as well, so that folks could, and that meant we extended our hours so that people could get out of the elements for in February for 24 hours a day, 7 days a week. In addition to the other services that were available in the community, we offered that in partnership with the municipality. So when that happened, we started to see people that we had not ever seen before. And um, so we weren't uh, cocky enough to say, oh, we have every homeless person in Chatham-Kent knows where Hopehaven is, knows what's available, and comes there. We would never say that. But we didn't realize that there were so many people that could utilize our services that we had never seen. So that is what prompted us to begin um, outreach. We said there have to be people then that don't know that we're here. And what can we bring to them? Let's just see what the barriers are, because we don't want there to be any barriers. We people are welcome at Hopehaven no matter what. They are welcome there to come in and have a meal and use our services. But we wanted to know what are the barriers, and that's how outreach actually started for us. So we started to go out initially just with a meal. We were taking food, and that grew based on what we were finding when we were going out. People needed emergency clothing. People needed even just to know that our services were there. We made up information packages for them. People needed to get connected with the rapid rehousing team. And so we take their cards out there when we go. So we're providing food. We have bus passes so that folks can get around within Chatham, and then people can travel like from Wallaceburg or from anywhere outside of Chatham into Chatham. So that was all about just, hey, suddenly we have people that we've never seen before. That must mean there is a hole in what we're providing. So that's how we got started with outreach. And it's been incredible. And it started with going to one place, seeing somebody new come into the Haven and say, hey, where do you go when you leave here? Oh, this is where I go. And people are pretty honest. People aren't, they're not, they're not trying to hide. They just, so they're pretty honest when they know that you really want to know. And so that's how it began. We started going to one place, and then we'd ask, is there anywhere else you know of that where people could use a coat? And yeah, sure, over there, over there, over there. And that's how it started. And that's how it started in Wallaceburg too. We went to one place where we kind of a place we knew to be rumored to have some folks there that maybe were experiencing homelessness, and we just asked anywhere else you would suggest. And holy cow,
Mhm.
there are a lot of places. And then people we would just see, you just see people, and because last week we saw them at that place, so now they're walking the street, maybe they're somewhere else. So um, that is how outreach began for us, just as a way to recognize um, what are the gaps, what can we do, what do you need, and we bring them what they need, and we also always give them the information, because ultimately, although it's there's no judgment, there's no right or wrong, there's no blame, but ultimately we want to try our best, if it's what they want, to be connected and to be on a waiting list, to be in line for services, to have somebody know about them, then we try to do everything we can to make that happen for them.
Thank you, Lloyd, for telling us that story. I think that's an important piece of the puzzle here is that outreach is critical
Mhm.
to some of this work because individuals are not connected to services. And when they want to be, to your point, when they want to be connected to services,
Yeah.
they might not know where to turn.
Mhm.
And Tara, I'm going to turn over to you because I know Employment and Social Services also does a little bit of outreach in some of the work that yourself and your team are working on. Do you want to speak to a little bit of the outreach that you're up to as well?
Yeah, no, absolutely. And it's very similar to how Lori explained it. Often we will find out that someone is sleeping rough, which just means outdoors. And whether it's one person or a few, I normally send my team of rapid rehousing case managers out there to do some outreach work. And what they do is they try to engage those individuals, build some rapport so that they can better assist them. Because often, as Lori said, they're not hiding. It could just be that they don't have access to our services, or they're not feeling safe with the services they have. And typically it's a last resort when they are sleeping outdoors. And so we really try to keep those relationships going. And over time, we hope that one of those times they're going to say yes, and they're going to come with us, let us connect them to the service that they felt they needed, that they couldn't maybe get before or weren't ready to get before. So outreach work is just so important.
Absolutely. And to both your points, there are many other organizations that are doing outreach in the community. And I think that brings us to a question that another viewer has asked, which, and this is kind of the capstone for the evening, are what are the gaps in services? When we talk about barriers, what are some of the gaps we are seeing in the services in our community that we need to start filling?
I can take this one to start. I mean, homelessness itself is a result of the gaps in service. But it, because there are so many gaps, that's certainly one of our biggest priorities right now. And it's all about how can we and our partners in the community close these gaps. How do we bring services that we don't already have available in our community to our community? So yeah, there are so many gaps, and I think it's not one particular agency that's going to be able to solve that. We need to work together and communicate with each other and really advocate to the province for the supports that we need.
Um, for just further to that, I know that people have asked about, the temporary funds and temporary influx of resources that happened as a result of COVID-19, or the perceived influx. But I think it's really important to note that those supports are temporary, and homelessness is not a temporary problem. If we can find housing for 10 people, fantastic. But there's 10 more people that aren't even there yet, that are heading there. So it's this is not going to go away. There's not something temporary to fix this. And it's, as Tara said, it's not going to be one thing. It's not going to be one group. um that would be like saying, me, I only have one need. Well, that's ridiculous. Of course I have lots of things that I need to get through my day, and so does somebody experiencing homelessness. So the gaps are enormous. And so, right, we have to begin with recognizing and being really brutally honest, and not taking it as a knock on any service that we are providing, or any effort that we're trying to put forth, or any group. The gaps are there. And we have to first begin, just like with the enumeration, we have to begin with identifying what they are and who they're impacting. And then we go on to step number two.
I really appreciate both those thoughts because these gaps we talk about, there's multitude, there's many. And I think it goes back to our conversation we had a little earlier around some of the variety of factors that lead to individuals experiencing homelessness. They are indicative of those gaps. And when we talk about, a lack of affordable housing, we talk about a lack of supports for individuals experiencing substance use challenges. We talk about all the other challenges that exist, be it COVID-19 and seeing huge rates of unemployment because of businesses having to close down for public health restrictions. All of these things are massive, massive challenges that our community and our province and country are experiencing. And it really, the phrase that comes to mind for me is it takes a village in many ways. It really does. It's not just one agency or one person that can address this. So I appreciate both your points on that one. And now, as we're getting closer to 8:30, I want to give you both an opportunity to kind of give some final thoughts here. And I know that Tara, I believe you have an announcement about the 20th coming up, and Lori, you have a couple pieces you want to mention about how to donate and volunteer. So I'll turn it over to yourself, Tara, first, then we'll jump over to Lori.
Great, yeah. So December 20th, which is Monday, Employment and Social Services, as well as our housing division, are bringing forward a report to council with some shelter options in Chatham-Kent. So it's going to be a really good council meeting to tune in for. And it would be, it'll be a good starting point for us anyways.
And when you say you're bringing a report to council on the 20th, is there anything that the community members can do to support that report to council anyway?
The agenda is up and it's public, so anyone can go in and can read exactly what the report does entail prior to the meeting. And then, of course, they can sign on to watch it at 6 o'clock on Monday. And that would be a great way to show their support and gain the knowledge.
Fantastic. And if I'm understanding, I believe council is able to you're able to watch council meetings either Facebook Live, YouTube Live, I believe as well. So there's various ways you can tune in, and of course your TV has it playing every Monday that they're on. Okay. Yep. Perfect. Thank you so much, Chair, for the great announcement. And Lori, I'll turn it over to you. Tell me more about Hopehaven volunteer donations. What do you want to mention?
Well, just to reiterate that we are open 7 days a week from 10 until 2. And during that time, people can come in for a meal, some emergency groceries if they need them, emergency clothing. They can do their laundry. They don't have to bring anything except their laundry, and have a shower. So if you think in that context, that would then mean that Hopehaven can always use laundry soap, um, clothing, especially as the weather gets colder. It would be absolutely abnormal to have a week go by that somebody didn't arrive without any shoes on at all or a coat. So those are things that we always need. And food, grocery cards, all of those things are always welcome. If you have it in your heart, if it's playing on your heart to give, we can certainly find somebody that needs it. As well, what we need the most really is people's time. We have, in addition to having 2 staff at all times, there are some paid staff. We also have volunteers that are sorting donations, that are putting together emergency food packs, that are just helping to keep things organized and running. And so there's lots of opportunities and there's really lots of need. We also have somebody that's cooking in the kitchen, making sure that there's something nutritious being served. So we can always use your help, whether it's 1 hour a day or a week or whatever somebody might want to give. And you can, in fact, I see when you see an increase like this and you hear us talk about the solution is affordable housing, and you may be sitting and thinking, well, I can't help with that. What am I going to do to make a positive impact with affordable housing? And that very well may be the case, but you can impact somebody by donating a warm hat. You can make a difference to somebody by being there when they come in to help with the COVID screening, and smile, because through your mask, smile with your eyes, but it's COVID-19 after all. But you might be the only friendly, welcoming face that person has seen. So there are lots of opportunities, and I will promise you that you will also be impacted by the people that you meet and the stories that you hear. So you can, like I say, the Haven is open every day. You can call, you can go to the Haven and talk with somebody. Somebody would happily chat with you. You can always reach me chathamhopehaven@gmail.com. We have a Facebook page. We're pretty easy to find.
And if you don't mind me asking, with Hopehaven, do you mind just sharing the address just for those who might be listening in who might be wanting to direct someone your way for support?
Sure, absolutely. 183 Wellington Street West is the address. It's a little bit hard to see if you don't know what you're looking for because we are in the basement of a church. So that's what you're looking for. There is a sign out front, but just come around the back, ring the bell, and anybody is welcome. Um, yeah. So men and women are welcome.
Fantastic. Thank you so much, Lori. And just before we end the night conversation, I'm going to turn it back to you both again to give us just a quick recap. If we had to say summarize enumeration in a couple sentences, what would you say are the big takeaways we need to know about enumeration?
Wow, that's a loaded question, Phil.
I know there's a lot to know. I know.
Well, oh geez, one sentence. Well, I think that for me walking into it, I was thinking it was going to be this enormous uh, event experience, and it was. Don't get me wrong, it was. But really getting down and walking on the ground with all the teams and volunteers and connecting with the individuals that we did was just amazing. And so for me, that was certainly that's the thing that stood out to me the most was really connecting with the individuals we spoke with. So I don't even know if that answers your question, but that's what I think of when I take away from enumeration.
That's great. And Lori, yourself.
Well, you may know that quick is not my strength, but I'll do my best. I would say that it confirms that this is a growing Chatham-Kent problem. That's it. It's growing, as is the effort to help, but the problem itself, and for the people that are experiencing it, is growing, and it's ours.
Both very well said. I'm so happy that both of you were able to join us to talk about the enumeration. Congratulations to both of you for the completion of it. And we look forward to learning more about it during the community consultations, because I know it sounds like you're both still working to dive deeper into the data and understand those numbers a little bit more. And I believe we're going to have a follow-up PowerPoint presentation that will play again at the end of this video for those who might have missed it at the very beginning. Otherwise, in our comments section, you'll be able to see individuals from Employment and Social Services in the municipality have been posting and responding to your questions, and we'll be able to post some more information. There were some questions regarding how to get in contact with yourself, Tara, with yourself, Lori, with both your agencies that you represent, be it Employment and Social Services or Hopehaven. So we'll be able to post that in the chat and make sure people are able to contact your organizations in the coming days if they have any questions about enumeration or just supports they're looking for. So with that being said, thank you to the both of you for joining us tonight. And thank you for those who have been watching for the past hour. I hope this has been illuminating and inspirational, as well as a great deal of knowledge being gathered to understand what's really going on in our community around those who are experiencing homelessness and the large scale challenges that all of us in our community are facing when it comes to addressing the challenges and barriers of homelessness in Chatham-Kent. As Lori said, and as Terry said, it's ours. Let's own it, let's work together, and let's address it properly. And with that being said, good night, everyone. Thank you so much for joining us.